Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. How are you, dear viewers? I hope all of you are well and fine. Dear viewers, today in this video we are going to see another lecture of the culture test, that is the prostatic fluid for CS. All of you better know that culture sensitivity test is actually the microbiology test. And we already talked about different culture test like blood culture test, pus culture test, we talked about urine culture test. Okay, so we talked pleural fluid for culture sensitivity. So we already talked about different culture test. If you missed this video lecture, it will be present into my channel. You can go back to my channel and watch all the culture test video lecture. There will be a playlist available, okay, which will be the culture test. So you can go and watch all the video lecture that is related to the culture test. So today in this video we are going to see prostatic fluid for CS. My name is Muhammad Kamla Khan and you guys watching my channel Kami Microbiologist. So let's start the video. So dear viewers, let's see that what we are going to talk about in this lecture. In this lecture, first of all, we will see the introduction, that what is actually prostatic fluid and prostatic fluid for CS. Then we will see the diagnostic purpose, that why we perform this test, why the doctor recommend this test. Then we will talk about the type of the media, or we will see what type of the common media we will use in prostatic fluid for CS. Then we will explain the requirements, that what we required while we performing this test. Then we will see the procedure or the steps that are we will perform in this CS. Then we will explain the most common bacteria that we will isolate from this prostatic fluid. After that we will explain that antibiotic, that once the bacteria is isolated, so what type of the antibiotic should be used. Then we will see the biochemical test, that once the unknown bacteria is identified, then what type of the biochemical test is important to perform in this CS test. Then we will see the precaution, okay. After that we will see the limitation. So these are the main content that we will explain in this video in detail. So please don't skip the video and watch the video till end. First of all, let's see that what is prostatic. Okay, so prostate is actually the gland. It is mostly available in the male reproductive system, okay, and it will be present below the bladder and also opposite to the rectum. And this gland contain a fluid, and this fluid is very important for the sperm transportation and to provide nourishment for the sperms. Moreover, we can say that this prostatic fluid also take a part in the sperm's formation, or it is a significant part of the sperm formation, okay. Now if we see diagrammatically that where actually the prostatic gland is available, so as you can see, this is the prostatic gland, this green one, okay, and it is below this bladder and opposite to this rectum, okay. So this is the short introduction to prostatic gland. Now let's see the prostatic fluid for CS. Dear viewers, it is actually the test, microbiology test, or we can say the culture test, in which we can identify the specific type of the bacterial infection or fungal, mostly bacterial infection, that can cause the abnormality in the prostate gland. And after that we will determine the most effective antibiotic that can be used for their treatment, okay. So this is the prostatic fluid for CS. Then what is the diagnostic purpose, means why we perform that test, why the doctor recommend this test. So the importance of this test, that this test is specially performed to identify the infection. Moreover, this test is used to isolate the specific microorganisms that can cause the infection in prostatic fluid. This test is also important to check what type or which antimicrobial agent are the most effective against the identified pathogens. This test is also important to check the response of the treatment which we are providing, okay. Now these are the diagnostic purpose, that why we perform this test. Let's see what type of the microorganisms we isolate from this test. So from this test we can isolate the E. coli, or the most common bacteria that we isolated during this culture sensitivity, this is the E. coli. So we isolate 40 to 50% E. coli when there is an infection, because E. coli is mostly found in the gastrointestinal tract, as well as this E. coli can cause UTI infection. Once the UTI infection is caused, so then it lead to the prostatitis. Remember, when there is inflammation in the prostate gland, we call it prostatitis. It means infection or the inflammation in the prostate gland or in the prostatic fluid, we can say like that. Then we have another bacteria that is available 10 to 15% during infection of the prostate gland, and it will be present because it is the normal flora of the intestine, and it also causes the prostatitis. Remember, it will be isolated when mostly in old cases, okay, in old men or in old people. Okay, so if let's suppose we have old men and it have prostatic issue, and if you see the bacteria, so the most common bacteria will be the Enterococcus in case of the old man. Next we have Klebsiella pneumonia, that is the 5 to 10%, and it will be available because it is also involved in the GIT, means gastrointestinal tract, and it also causes urinary tract infection, and then it lead to prostatitis. Next we have Pseudomonas aeruginosa. The Pseudomonas aeruginosa is 5 to 10% available in prostatic fluid during infection, and it will be present because we better know that Pseudomonas aeruginosa is the hospital acquired infection, and it will be present mostly in immunocompromised patient. Next we have Staph aureus. So Staph aureus is 5%, and it can cause prostatitis when the Staph aureus, all of you better know, when there is a pus infection, and when this Staph aureus is traveled to in the blood and then reach to the urinary tract, because it can also cause urinary tract infection, and from the urinary tract infection then it may go to the prostate gland, and in the prostate gland then it can cause infection. Okay, so this is how we can say that we have 5% infection chances in the prostate gland that can be caused by the Staph aureus. Then we have Proteus, and Proteus is 3 to 5%. It can cause 3 to 5% infection in the prostate, and it all of you better know that Proteus can also cause UTI, and then it can cause prostatitis. So these are the isolated microorganisms that we get during infection in prostate gland. Let's see the culture media. So we have different type of the culture media in this case. Okay, so the first culture media is the blood agar. Now blood agar can support the growth of every type of the microorganism like E. coli, Enterococcus, Klebsiella, Staph aureus, Pseudomonas, Proteus. So all the bacteria which I already talked, so all the bacteria can be easily grow in this blood agar. Okay, because this blood agar is actually enriched media, and this blood agar is also important to give us hemolysis pattern. Next we have Mecon key agar, that is the that will show us lactose and non-lactose fermenting characterization, and through this media we can grow all the bacteria except gram positive, means we can grow the E. coli, Enterococcus, Klebsiella, Pseudomonas and Proteus. Just Staph aureus will be not grow on this media. Okay, we can also say that E. coli and Klebsiella is the lactose fermented, Enterococcus also lactose fermented, while Proteus and Pseudomonas is the non-lactose fermented. So in this case we will use Mecon key agar. Next we have mannitol salt agar, which is specially a selective media for the Staph aureus. Next we have clade agar. Now why the clade agar is used? Because we already talked that clade agar is specially used for the urinary infection if you want. But the bacteria which I already told you, it can also cause the UTI infection. So if we use the clade agar, so it means that these bacteria will be also grow. Why? Because these bacteria can causing UTI, and then UTI will lead to prostatitis. So we will use clade agar when we performing the prostatic fluid for CS. EMB agar is also important because it is specific for the E. coli, and it is also lactose and non-lactose, showing the lactose and non-lactose fermentation. Now these are the culture media that we talked. Let's see the biochemical test, that what type of the biochemical test we should perform while doing the prostatic fluid for CS. So first is the gram staining. You must do the gram staining. Now from the gram staining, once you get that either this is the gram positive or gram negative, let's see, let's suppose if you get that this is the gram positive cocci, so then you must perform catalase, coagulase and DNase test. It will tell you either the bacteria Staph aureus, streptococcus or whatever the bacteria is it. Okay, so gram staining is very important. If let's suppose you got gram negative rods or gram negative cocci, so then you will perform some other test. Now when you got gram negative bacteria, so then you will perform urease test, that is especially for the Klebsiella and for Proteus. Endole test is also important for the E. coli because E. coli is endole positive. Catalase test is again for Staph aureus. TSI test is used for all gram negative rods. Oxidase test is used for especially Pseudomonas aeruginosa because oxidase test is positive in case of Pseudomonas aeruginosa. API testing is very important because it will tell it is important for the gram negative rods, and it can contain, I already talked all these tests. Okay, API test can contain 10, we have 10 API testing and we have 20 API testing. Okay, so here one thing that's really important, that I already explained all these tests. You can go back to my channel and watch the biochemical test list. It will contain all the biochemical tests. Okay, so here I am not going to explain it because it will take our video long, so that's why but just remember that these are the most important biochemical tests that we will perform in this prostatic fluid for CS. Last we have gas precursor, that is also used for the Klebsiella pneumonia. Okay, now next we have requirements that whenever we want to perform the prostatic fluid for CS, then what we need a sterilized container. Here I put a urine bottle. This is actually a urine or sterilized urine bottle. You can also use a syringe, a sterilized syringe, okay, through which you will collect the sample. Next we have this is actually the a spirit lamp. We need a burner as well. Spirit lamp or burner, it will provide you a clean environment. Okay, and through this burner you will also red hot the wire loop, which will be used for the streaking purpose. Okay, so that's why it is also important. Next we have culture media, which I already talked. It will support the bacterial growth. Next we need antibiotic disc. Antibiotic disc is important because it will tell you about the sensitivity, resistant and intermediate pattern. Next we need ethanol. Ethanol is also important because it is used to clean the surface area, okay, and also provide you a clean surface area. We also need wire loop because wire loop is important to do the streaking process. Now this is the personal protective equipment. So personal protective equipment is important to protect us from the infection. We need incubator because incubator is important to incubate our plate for 37 degrees Celsius, that will provide a temperature for the bacterial growth. We need LFH. LFH is also important because it will provide you clean environment. We also need autoclave, which I forgot to mention here. Autoclave is used to sterilize all the equipment or material which you will need for the culturing in the culture test. The procedure. So procedure is very simple. First of all, you have to collect the prostatic fluid sample in a sterilized container, mostly at morning time. Okay, next you will streak the sample on a selective media using SOPs, standard operating procedure. For example, first of all, you have to red hot the wire loop, means you will sterilize it. Then you will let the wire loop to be cooled down. Then you will dip the wire loop into the sample and will take the specimen and will streak it using quadrant streaking techniques. So this is the aseptic technique, or we can say standard operating procedure or microbiological procedure. Once you streak the plates, then you will incubate it at inverted position for 24 to 48 hours to check the bacterial growth. Once the bacterial growth is identified, so then you will perform the biochemical test. Through the biochemical test, the bacteria will be identified, and once the bacteria is identified, so then you will place the antibiotics. You will make the bacterial alone and place the antibiotic, the proper antibiotic, which are against the selected organism or the isolated organism. Once the antibiotic is placed, so then you will incubate this plate to check the sensitivity, resistance and intermediate of the microbes. Last, you will report the test. If there is no growth, so then after 24 to 48 hours, if there is no growth, so then you will write a sentence that no growth of any microorganism obtained after 24 or 48 hour incubation. If there is growth, so then you will write the growth of E. coli or Klebsiella or what type of the growth you get. So you will mention the bacterial name, and then you will write the antibiotic, those antibiotics that are sensitive or resistant or intermediate. Okay, this is the simple procedure of the test. Antibiotic profiling. So remember guys, if you get E. coli, so these are the antibiotic you must use in case of the E. coli. Means you will use ceftriaxone, amikacin, amoxicillin plus clemminamic acid, tazobactam, salzone, imipenem, ciprofloxacin, fosfomycin and gentamicin. Enterococcus. So if you get enterococcus, you will use ampicillin, vancomycin, doxycycline, linezolid, gentamicin. You can also mention 5 more antibiotics, but these are the common antibiotics that you must use. But if you add 5 more antibiotics, it will make your report valuable. Next, we have Klebsiella pneumonia. So if you get the Klebsiella pneumonia, you will use ceftriaxone, cefotaxime, tazobactam, salzone, imipenem, meropenem, ceftazimide and cholecystine. If Pseudomonas aeruginosa comes, so then you must use tazobactam, salzone, imipenem, meropenem, ciprofloxacin, levofloxacin, polymyxin B, cholecystine, ceftazimide, this is actually cefazole or cefametazole. Okay, and next you will use gentamicin. If Staph aureus comes, so then you will use vancomycin, clindamycin, fusidic acid, clarithromycin, linezolid, cefoxetine, tigecycline, ciprofloxacin, oxycycline, amikacin and moxifloxacin. If Proteus comes, so then you will use ciprofloxacin, levofloxacin, sulfametazole, or we can say Septron. You will use ampicillin, tazobactam and salzone. So these are the common antibiotics that you must use when you get this type of the organism which I already talked. Okay. Now let's see the precaution. What type of the precautions you must adopt while performing the prostatic fluid for CS? The first thing is that you must collect the sample mostly at morning time, because at morning time the infection is on a peak stage. Whenever you are performing the work on top bench, so you must clean it with ethanol, 70% ethanol or alcohol. Okay, that will provide you a clean environment, or it will reduce the risk of contamination. You must, once the sample is collected, so then you must process the sample within 1 to 2 hours, because if you didn't do this, there will be contamination, there will be the bacterial growth will be suppressed by the other bacteria, and this will cause false report. Okay, this will cause to generate false report. Let's suppose if you perform the work tomorrow, so then you must store it at 4 degrees Celsius. It will reduce the bacterial growth, or we can say stop the bacterial growth. Next, you must use quality control. This quality control is important because it will give us an idea about your handling, and also about the culture media that you are using, it's good or not. And quality control, you must use a bacterial growth that you have, means Pseudomonas, and you also use a negative growth which doesn't contain any bacteria. Once the bacteria is identified, so most of the technicians will ignore the gram staining and biochemical test, because they have some expertise, and by examining the colonies, they will say that it's a gram positive or gram negative, and it may be Klebsiella, or means it is not important that you will predict the organism. You must perform the biochemical test and gram staining, because it's very important to identify and to make sure the bacteria. Okay, then the treatment is very once the bacteria is identified, so then due to this way we can easily provide the treatment, the appropriate treatment. Okay, next, whenever you are using antibiotics, so it's very important that you must use the appropriate antibiotic against the selected bacteria. Okay, let's suppose if the Staph aureus come, and then it doesn't mean that you will use the GNR antibiotics. Okay, so you have to place the antibiotic according to bacteria. Once the zone of inhibition you observe, so you have to measure it using CLSI guideline. Every year the CLSI guideline is changed. Okay, so you must follow the CLSI guideline while measuring the zone of inhibition. Next, if you are doing culture sensitivity test, you must guide the patient to stop the antibiotic before 1 week of the culture sensitivity test. It will give you accurate result. If other bacteria come except the bacteria which I already told you, or fungus comes, so then you will consider it as a contamination and you will ignore it. Okay, next, you must ask patient history, age and sex. It will help you in the CS test. What type of the limitation we will face during this case, during this CS? So the first limitation is that in this case the patient will feel uncomfortable, because in this CS we use invasive procedure, because in this CS we sometimes we prick or sometimes we massage the prostate area, due to which the patient will feel uncomfortable. Next is sometime what will happen, it will cause contamination, or the sample which you obtain, so what will happen, sometime the normal flora will comes to the urethra, and then it will sometime the normal flora will come from the surrounding tissue. That will give us a false positive report. Okay, so this will also happen in this CS. In this CS, what will happen, sometime chronic prostatitis will occur, due to which the bacterial load is become low, and due to this way the microorganism isolation is very difficult. Next, that let's suppose if the patient are using antibiotic, so it will also generate a negative false report. Why? Because antibiotic will suppress the bacterial growth, not bacterial, they will not kill the bacteria. Okay, so that's why for proper antibiotics, if you are using not proper antibiotics, so obviously it will suppress the growth of the bacteria, and the infection will be not treated. You will generate the negative report, but still the patient will feel infection. So that's why you must guide the patient to stop the antibiotic while they are doing the CS test before 1 week. Moreover, all the culture test will take a long time. Minimum it will take 24 hours, and maximum it will take 2 weeks, 3 weeks. Okay, so this is the limitation of the prostatic fluid for CS. This is all about the prostatic fluid for CS. Thank you so much, friends, for watching. I hope you like this video. If you like this video, make sure to hit the like button, share this video, and subscribe my channel to get more interesting videos like that. Thank you so much for watching.